Very good evening, everybody. Meeting again in the session of Materia Medica. And today we're going to learn one more important remedy, in fact, more important remedy in homeopathic practice, that is the Chelidonium Majus. It is as good as important as lycopodium for us. In what happens, we generally fix this remedy as an organ remedy, as a liver remedy. And that's the thought in our mind when we learn the Chelidonium Majus. But if you'll go with the George Vitulka's Materia Medica Viva, he has explained this remedy up to 50 pages, around 40 to 50 pages have been devoted to Chelidonium Majus in the Materia Medica Viva by George Vitulkas. And this is a wonderful remedy in many types of pathological elements. So we have to learn this remedy by heart and utilize in our practice. Many times we miss this remedy because it looks very closer to the lycopodium, it looks very closer to the Naxomica, it looks very closer to the Bryonia, and that's why we miss the Chelidonium many aspects. And for that purpose, I will going to share one case with you. It was an interesting case because it was the case which was a complex. A patient around 30 years of age suffered from fever and admitted in the hospital. Fever was persistent nearly about 10 to 12 days, and they have investigated him a lot. He was diagnosed that it is a complex, it is a malaria plus enteric fever plus pneumonia, all three disorders. It is a complex over there. And he was given many varieties of antibiotics in between those 12 days. Ultimately, fever came down, but patient has lost appetite. Patient has become so prostrated weak because of that, those antibiotics, those medicines utilized for that he felt so anxious about his disorder that whether he will feel better or not. He never wants to do anything because there is continuous indigestion which has been developed because of long continued use of medicines. He had an increased serum bilirubin. He had urine bile salts, bile pigments. And doctor said this is secondary to the antibiotics. It is because of overload of antibiotics, liver gets compromised, and that's why there is a problem. They said now we'll stop the antibiotics and we'll keep him on glucose and all those things, and glucose, all those things were already going on. So he was frustrated. His liver was enlarged, his spleen was enlarged. One of the internee in that hospital has given him a Naxomica 30. Naxomica 30, with Naxomica 30, he felt little bit better, but he was having very severe pain in right hypochondriac region. And he was explaining it that it starts over there, it goes to the backside, and it is terrible. It is stitching. It is as if something very severe pain I could not express. That was the patient's sentence. And then I asked where exactly the pain is. Then he defined that it is on my scapula, and just inner side of the right scapula, the pain is there more marked. But it has, doctor, it has started right from my right side and then enters over there. That was one important thing which he has mentioned. Second important thing which he has mentioned specifically is that whenever I have developed this fever, and after fever, I have started getting those medicines and all those things. I'm feeling something wrong over here in stomach. I'm very anxious. What is happening in over here in my stomach, in my abdomen? I could not explain you, but I'm always worried about that. A lot of worry is there in my mind regarding my abdomen. Do you feel that I will get better with homeopathy? That was his question. He doesn't have stress. In fact, since last 20, no, 15 days, he was not attended his work. So company has offered him to do a work from home. So I asked, why don't you start to do your work? He said, no, I could not. I'm not feeling well, doctor, here in stomach. How can I concentrate and I'm on work? He said, not possible. Work is not possible for me. First, comfort me at this level, remove my pain, then I will be able to sit for hours, because it is not simple job. I have to sit for 8 hours. And he was absolutely disturbed because of his indigestion. So it is a complex fever associated with hepatic enlargement, associated with splenic enlargement, associated with a severe dyspepsia, associated with severe pain in right hypochondriac region, going towards the right scapula, and there is an aversion to do any work. Those things were there. First, I thought it is definitely Nux, but Nux has not acted, which he has already received. So what to do? So I opened the just a repertory. I looked for certain specific things, whether what remedy comes under that. And when I was going for it, there was one rubric that abdomen pain, liver region, extending back scapula, lower right, angle, so lower right. Single remedy chelidonium was missed. I was knowing chelidonium, but I was not considering chelidonium. I was knowing it. I used to use it in liver pathology, but I was not consider that there it covers the pneumonia, it covers the malaria, it covers the enteric fever. Then second rubric I got work mental aversion to dyspepsia in. Work mental aversion to dyspepsia in. Again a chelidonium for 3 marks, 4 marks, single remedy. So two pillars were there. I was searching for the anxiety, which was seen on his face, and anxiety related with his stomach condition. So I was just finding it out, and there was one rubric, anxiety stomach in, fever in hepatic typhoid, Chelidonium 3 mark single remedy. Then rest of the things are there. We know the Chelidonium is very good remedy for pain in right hypochondriac radiating to the back. Very important remedy. But this time, I have not utilized the mother tincture. I have started him directly on the Chelidonium 30 3 times a day. At that time, actually, I have read the Chelidonium from George Vitulkas, and I was surprised to read whole Materia Medica, 40 pages about the Chelidonium, and then I consider how much depth this remedy is having. The remedy not only covers these complex fevers, but it also covers the pneumonitis, right-sided pneumonitis. It covers even tuberculosis. It is a wonderful remedy for right-sided tuberculosis. So many pathologies which has been mentioned very nicely by George Vitulkas in his Materia Medica Viva. And then I confidently prescribed the Chelidonium 30 3 times a day. I was knowing that action of the remedy was only 7 to 14 days. So repetition, it bears the repetition. Boric says it should be given in mother tincture or lower tracturation, but I have tried it in 30 because the symptoms were very prominent. And when I started Chelidonium 13, asked the patient to meet me after a week. In fact, within a week, he got a good, nearly about 2-3 kg weight gain, which was lost. There was loss of 5 to 6 kg. Within a week, 3 kg gain was there again. His appetite improved. His fever, actually, it was stopped before coming to me. Then there was no more recurrence of fever. Then nausea has disappeared, and basically the pain which was prominent, the scapular pain, which has completely disappeared under the action of Chelidonium 30. So I continued with Chelidonium for further a week. and I have checked the serum bilirubin, and serum bilirubin dropped to the normal. Generally, in such complex cases, whenever the antimalarial antibiotics are used, generally liver gets compromised. The enzyme levels gets affected, and they are secondary to those medications. Yes, definitely Nux vomica plays very vital role in such types of cases. But here, the symptoms were calling for chelidonium. And that's why I took decision to prescribe chelidonium, and it works beautifully. Within 15 days, the patient came to the normal. So this was interesting case, which which showed me a different aspect of looking toward the chelidonium. So today we're going to learn chelidonium from Allen's keynotes. Allen has very nicely mentioned many things about chelidonium. So let us open the Chelidonium Majus, a remedy which was proved by Dr. Samuel Hahnemann. Common name is Cilandin. It is a remedy from Papaver family. First sentence, he explains the constitution of chelidonium. The persons of light complexion, the blondes, thin, spare, irritable, subject to hepatic, gastric, abdominal complaint. The complaints are related with liver, complaints are related with the gastric element, and abdominal complaints like podophyllum. So very close association. In one sentence, first sentence, he has mentioned where the center of action is there. Then second, he says, persons of every age, both sexes, and every variety of temperament. It is not fixed temperament with chelidonium. So it is a wonderful remedy to be considered in such types of specific constitutions. Whatever is given in bold has a meaning. And this symptom, whether it is related with liver complaint or not related with liver complaint, if it is present in chelidonium, give the chelidonium. Constant pain under the lower and inner angle of right scapula, very strongly given for chelidonium. It is the symptom of chelidonium. Kalika is another remedy, but Kalika, the stitching pain is more characteristic, and patient is aggravated by lying on same side. Patient is that is the characteristic of Kalika. Mercury is another. If it is under the left scapula, then chenopodium and sanguinaria. These are the two remedies mentioned for it. Elements brought on or renewed by the change of weather. So this is the remedy which reacts to the change of weather, like mercurius. All elements are lessened after dinner. Patient feels better always after the dinner. This is very typical modality of the chelidonium. Tongue, the coated thickly yellow. It is marked yellow coating. It is bilious temperament which is marked over there, with red edges showing imprints of teeth like podophyllum, like mercurius. Large flabby with imprints of teeth is mercurius. So you must remember the tongue of chelidonium, thick yellow coated with large flabby tongue with imprints of teeth. Imprints of teeth is very marked with chelidonium. Desire for very hot drinks, unless almost boiling stomach will not retain them. So it is very close to the arsenic. They always craves this very hot drinks, very hot drinks. So these people, we surprised to look those types of people who takes the cup of tea and it is fully boiled cup and directly puts it in mouth and immediately finishes them. You ask her, it's very hot. This is, I like that only. I don't like the cold tea. And even warm tea, I could not like. I want it very hot. That is the characteristic of chelidonium. The periodic orbital neuralgia of the right side. See, right-sidedness is another characteristic which is close to the lycopodium, close to the bryonia. So the periodic orbital neuralgia, right side, with excessive lacrimation. How is the lacrimation? The tears fairly gush out. They are coming out very fast, very strongly. Restox is another remedy which is mentioned for the gushing out lacrimation. Constipation, stools are hard, round balls like sheep's dung, like opium, like plumbum metallicum. Alternate constipation and diarrhea like Naxomica. Diarrhea at night, slimy, so it contains mucus more, light gray, bright yellowish, brown or white, watery, pasty, and involuntary. So there are both the things. Constipation is there, also diarrhea is there. If constipation is there, the stools he has mentioned over there. If diarrhea is there, the characteristics of the stools are mentioned. And both are important. It is not every time you are going to get constipation, you are going to get constipation sometimes. In some cases, you might get diarrhea. In some cases, you might get alternating feature. Face, forehead, nose, cheeks remarkably yellow, and that is the jaundice of Chelidonium, for which this remedy is famous for. Yellow gray color of the skin, wilted skin of the palms and hands. So it is typical yellowish presentation like sepia. Sepia is a remedy where portal congestion is more marked with jaundice. Hepatic diseases, jaundice, pain in right shoulder. So this is very important remedy for liver complaints where there is jaundice and associated with pain radiating to the right shoulder. These are very important things which are mentioned over there. Pneumonia of right lung, liver complications like mud. So pneumonia of right lung, right? It is very clearly right lung pneumonia followed by the liver complications. So pneumonia is inflammation of the lungs, specifically the right side, associated with hepatic complication. Correlate this. This is very important. Even patients, sometimes there is a diaphragmatic elevation also happens to be there in Chelidonium patients. Spasmodic cough, small lumps of mucus fly from the mouth when coughing. So whenever patient is coughing, the expectoration flies out like Kali carbonicum. Kali carb has that specific. When they cough, they suddenly expectoration. Yes, it has been mentioned. Badiega and Kali carb, those remedy. Affects right side most, right eye, right lung, right hypochondrium, abdomen, and right hip and leg, right foot, cold as ice, left natural. So very close to the lycopodium, right side ending. Very marked. Lycopodium also have the action on liver. Lycopodium also have right-sided pneumonitis. Lycopodium also have right to left shift of the complaint. So lycopodium is very close remedy to the Chelidonium. Only thing is that Chelidonium has the 7 to 14 days action. Lycopodium is very deep, nearly about 40 to 60 days of action. It is more strongly antisoric remedy, lycopodium. Chelidonium is not to the that depth, but Chelidonium covers the inflammatory phases more marked associated with these those abdominal and lung pathology. Old putrid spreading ulcers with a history of liver disease. See, old putrid spreading ulcers. So ulcers which are spreading, which are old enough, which are putrid, having putrid discharges, offensive smell, with a history of liver disease and of course tubercular diathesis. So miasm, you can find it out. This remedy is pseudosyphilitic tubercular miasm. Gallstones. This is a very important remedy for gallstones. Gallstones with pain under the right shoulder blade. If there are terrible attacks of gallstone conic, one important remedy, Cardus mar, you should not forget. But Cardus mar is having one important feature. Left lobe of the lung gets involved in Cardus mar. That is a very important feature one must think about Cardus mar. Relationship, Chelidonium antidotes, the abuse of bryonia, especially in hepatic complaints. Compare Aconite, bryonia, lycopodium, murk, nux, sanguinaria, sepia, and sulfur. Very close remedies, but everyone has their own impressions. Arsenic lycosulfur follows well and will often be required to complete the cure. And these are the remedy, out of which lycopodium and bryonia, these are the complementary remedies to the Chelidonium Majus, as mentioned by Boric in his Mathematical. Antidote to the remedy is chamomilla. Action is 7 to 14 days. Boric has written one more sentence in his Materia Medica that sulfur often requires to complete the cure after chelidonium. That is a hint, practical hint, which has been mentioned by the Boric in his Materia Medica. So that one should not forget that sulfur, it is a very important remedy to complete the cure. If you treat with the chelidonium and patient recovers, this is one important hint given by Boric, and it has a significance. So these are things one must learn about chelidonium. My suggestion, go through different books, even Nash Materia Medica or leaders of in homeopathic therapeutics, Nash book, he has mentioned very nicely the chelidonium. A free flow of understanding chelidonium you can get with Nash Materia Medica. The same is true with Materia Medica Viva, with George Vitulkas, but he has explained the depth of the remedy. So you must make an habit of reading all those Materia Medicas, different Materia Medicas, the same remedy, and then a core develops in your mind with which you can apply the remedy. So that's all for the Chelidonium Majus. Tomorrow we'll continue with another remedy from the third year syllabus. So we are learning many more remedies in this sessions, and these are very useful remedies in our day-to-day practice. My suggestion to all of you, I have taught you the way. You have to grasp it, and you have to go with rest of the Materia Medica to learn the depth of action of the remedy. As time permits, we're going to learn it from different Materia Medicas also. But first, I will going to complete it from Allen's, so that it is simple way of learning the Materia Medica. So that's all for today. Thank you very much. If any query is there, we'll have a chat. Otherwise, we'll complete session.
Sir, this right shoulder pain.
Yes.
Many person who are having this liver problem is having right shoulder pain, sir.
Yes. It,
So,
yes.
whenever a person is having a right shoulder pain, he has to check for the liver like this.
Hmm. You can think about this remedy. Chelidonium is wonderful remedy. Second remedy I will suggest is lycopodium, if it is specifically shoulder pain is there. Third remedy which you can think about is the sanguinary also, having a very specific action on right shoulder. It depends, varies from patient to patient depending upon the sensations. If it is stitching type of pain in right shoulder associated with liver complaints, bryonia is one more remedy. Kalikap is also, but Kalikap, it is aggravated by lying on same side. Bryonia, it is better by lying on same side. So you have to take into consideration the minute details about that symptom so that you can prescribe right remedy.
Thank you, sir.
Okay.
Sir, what about mother tincture? Some
Yes, mother
person are
tincture.
using.
Mother tincture I used to use in my practice very commonly regarding this remedy many times. To control the bilirubin levels, Chelidonium mother tincture is a wonderful remedy. I used to use it in many times. Even in cancer cases, I used to use the Chelidonium mother tincture. It is a wonderful remedy. But in that specific case, the symptoms were very strong. And when symptoms are very strong, you can use the dynamic potencies.
And sir, doses about
Hmm?
mother tincture, BD or TDS. Doses, BD or TDS.
I used to give
How
it
it is?
BD. Generally, I used to give it in BD doses. 15 drops in a half cup of water twice a day.
Thank you.
So, thank you being there. We'll meet again tomorrow with the new remedy. Good night.
Thank you, sir. Good
Good
night.
night, sir.